The more eyes and hands that we have, partnership between the pet owner and between their veterinarian is usually very instrumental in detecting cancer early.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello, friend. Today on Dog Cancer Answers, we're taking a listener line call from Janet, who has a plan for how to catch anal gland cancer early in her breed of dog. And she's wondering if there are other guidelines that we might want to put in place for our dogs. To answer that question and more, we are bringing back Dr. Brooke Britton, oncologist, for another episode of Dog Cancer Answers. Dr. Britton, thank you so much for joining us today.
Thank you for having me.
So we're going to hear from Janet, and she has a question about early indicators.
My question is mostly a suggestion, and that is in experiencing cancers such as anal gland cancer and lymphoma, I have studied extensively globally to learn what kind of indicators might be available. And it would just be great with all the information you have, and I work with WSU here in the state for help knowing when to start looking for signs of these potential killers in our dogs. I know, for instance, the glandular cancers tend to occur at 6 years plus, and that there are things that can be done just as simple as having a vet check on anal glands, for instance, every 6 months after the age of 6. So if there are other things that could be put on the list for owners to know on a timeline basis when we could be looking for some warning signs, I think that would be very helpful in our care and also in making our local vets partners in looking out for these serious diseases. I've followed your podcast for many, many years. You've been helpful to me in many ways. And if I ever can give back, of course, I will do.
Well, thank you, Janet. That's so nice to hear. And I really appreciate you calling in with your question, which I think is a great one. Dr. Britton, what are the things that we who love dogs should be doing on a regular basis throughout their lifespan to check for cancer? Janet thinks that anal glands should be checked every 6 months after the age of 6. Is that a good idea? And are there any other tips that you any things for us to put on our to-do list?
So many things.
So many things.
So many things. So I think that Janet's question is a really great question because, and she does make a point at the end of talking about how it's a team effort, because it really, really is, between people monitoring their dogs at home, between their primary veterinarians and sometimes their specialist veterinarians if they need specialty care. So it really is a team effort monitoring these things. Honestly, I think one of the best things that people can do is to bring their dogs regularly for wellness checks, to which she also alluded. In general, when a dog is in their younger years, once a year is generally adequate, as long as they're healthy and happy and eating well and no major behavioral changes, no major weight loss or anything concerning of that nature. As they get older, and older means something different depending upon the breed. I know a lot of large to giant breed dogs tend to age a little bit more rapidly internally than some smaller dogs, for example, or purebred versus mixed breed dogs in some cases. So older really depends on the breed we're dealing with. Often we're getting a little bit older when we're in the 6 to 8 plus range for large to giant breed dogs. We're getting a little older in the 8 to 10 year plus range for kind of medium dogs, and maybe 10 plus for smaller dogs. And again, those are just general guidelines. But as we get older, sometimes those wellness exams are increasing in frequency, maybe every 6 months, as she alluded to. And things that we do during a general wellness exam, including in my cancer patients who are in remission, but I'm monitoring them for their general health and perhaps recurrence, are looking at structures that we don't commonly pay attention to in our everyday today with them, such as the anal sacs or anal glands. They can hide tumors like anal sac adenocarcinoma. And they're often tumors that you would more feel internally versus see externally, with exception that usually if you start to see a tumor in the anal sacs externally, we're in more trouble.
You're in trouble,
because it may have been growing for a longer period of time, or it may be more difficult to remove once we can actually see it from the outside. Feeling lymph nodes externally, many vets are very adept at feeling peripheral lymph nodes for evidence of lymphoma or other infectious diseases or other cancers. So that type of screening happens at a wellness visit. Feeling for lumps or bumps all over the body is also something that we do routinely. And if someone at home feels a lump or bump, or they feel that their dog is just not feeling well, or that something is amiss, then having a spontaneous appointment or a recheck appointment in between wellness visits is very important to bring that concern to a vet's attention so that we can address it promptly if it ends up being something indeed that's more concerning and needs to be medically addressed. The other thing that happens at wellness checks is oftentimes baseline blood work and other testing for infectious disease, for parasites, other issues that can cause quality of life concerns that can mimic certain behavioral and other constitutional changes that we can see with cancer, and can be differentiating test. Is this something that is an easily fixable problem that is something that can be dealt with in one visit or two visits, or is it something where we've actually diagnosed a more serious disease or a cancer where we need ongoing treatment? So many of these things can be picked up at a screening visit through a basic physical examination or through baseline blood work. At home, cancer signs can be sometimes very nebulous and very subtle. It's not always seeing a tumor or feeling a tumor on the body. Sometimes we'll see behavioral changes in terms of how a dog or a cat, for that matter, behaves. Maybe they are lethargic or more withdrawn. Maybe they are spending time in a different room or on a different surface, even rug versus hardwood floor or tile. That is atypical for them. Maybe their day-to-day routine is disrupted. They normally follow you around all the time from room to room when you're working from home. So sometimes these things can be very subtle. Other times we notice that they're not eating very well, or they're having GI distress like vomiting, diarrhea, they're losing weight, other types of signs that are non-specific and that they could indicate other things that may be benign, like a GI bug, distressing nonetheless. But those types of signs can be signs related to cancer as well. So any deviation from the norm, especially if it's persistent, increasing in frequency or worsening over time, is important for us to bring to the attention of a veterinarian.
It strikes me that we know our dogs best, right? We know our dogs better than anybody else could. And so as dog lovers, we just really need to have a picture in our head that we can compare. Our dog today is behaving like this. Is that who we know our dog to be? And any deviation from that, I think there's an intuitive sense sometimes. There's just something off. Something's just not right. Mm-hmm. And we should pay attention to that, sounds like you're saying.
It's true. And sometimes these things are so subtle that, a person may bring their dog in to see me and say, look, he's just not right. I can't put my finger on it, but there's just something that isn't right. And I think that's a hard one for vets to field because it's nonspecific and it's very broad. But at the same time, it doesn't make it any less valid, because many times when people bring that to our attention, they are right. It's something that is not quite right with their dog and something is going on. So it's important, it's important to note those changes. And again, especially if there's a pattern or a trend where they're increasing in frequency or duration or worsening in any sense.
Dr. Dressler once told me, as a general practitioner, whenever he sees a dog for a wellness visit, he says the average is 3 to 5 things that are off that aren't ideal, that might be indicating that something's going wonky and needs to be addressed and helped along to keep that dog healthy in the long term. And those wellness checks, it seems, your dog's 6, you don't think my dog's older, but so your screening guidelines basically are once a year until your dog is older, 6 for a large breed, 8 to 10 for a medium breed, and 10 plus for a small breed, and then 6 months ever after, basically, for those wellness checks, just to make sure that everything's lined up.
That's a general guideline. There are some people that would want screening more frequently, and that's not wrong to do. It's never wrong to go see your vet, just for a wellness check, even every 6 months, if that's something that makes you feel better. And your veterinarian may not always run every single test or every single diagnostic at those visits. And most will kind of have a set interval at which they do those diagnostics, like blood work, for example, especially if we do feel that a dog is truly healthy and we're not seeing any red flags of concern. While just like in human medicine, you may not, even if you have a family history of, let's say, gastric cancer, you may not get ultrasounds, every 6 months, or even at your annual physicals. There may be certain intervals that we alter or adjust for dogs that are more predisposed to certain types of cancer, especially if they have a history in their lineage where we may be screening them more frequently, or we may do a diagnostic like chest x-rays or an ultrasound, as they get older, even if they appear to be completely well, so that we're trying to catch these disease processes early, especially with cancers that are very insidious that may develop and progress over time, where we may not have any outward signs of illness until they really start to get bigger and feel sick.
I recently spoke to Dr. Jules Benson with Nationwide Pet Insurance, and he was talking about the 2 papers that they've released so far this year, white papers based on their claims data for, I think it's 1.5 million dogs. So they had this huge sample size. And one of their goals as they continue to release these white papers is basically they're just saying, here's an interesting pattern. And he wants to be able to, for every breed, have a list of diagnostics or things to look out for, because they have it in their claims data. They know what is happening with dogs in their sample, obviously. But we might be able to have these tools where we can say, oh, you have a doxy, so you want to start checking for X at age 5. And by the time they're 8, they should do this one diagnostic for this one thing. That seems very like a really useful tool to me, that we start to get some more specific guidelines based on breed, size, age, whatever is coming up. Does that feel juicy to you?
Yes. Yeah, with a caveat. I think having that much data, because a lot of our veterinary studies are kind of small sample sizes at best, I would say. It's rare for us to have studies, especially prospective designed studies that have hundreds of patients. It often doesn't really exist in our world because it's difficult to get that number of patients like it is in the human realm, where they have many more patients for their clinical trials. So even though this is what we would call retrospective data, we're sort of analyzing it in retrospect and seeing what blood work abnormalities these dogs had, what's clinical symptomology they had before they were diagnosed with certain cancers or other diseases. These are always guidelines, though. So the only caveat I would say is that that data is very valuable, but then we also have individuals. And so we can make some generalizations and use that to guide our decisions, but we always have to look at the individual patient and say, well, what do I think is most appropriate for this individual? And if it's doing a screening diagnostic or not, as the case may be, sooner or later than those guidelines might suggest, if they materialize, then that's if we're doing that, that's because we think it's in the best interest of the patient. So we always have to look at the individual and adjust the guidelines to what we think that that patient needs at that time.
That's an excellent point. So often, in our Facebook group for folks who are dealing with dog cancer, for example, we'll hear, a very common complaint is my vet didn't think to do this, or my vet skipped this test. And I often feel that what's really being expressed is, I wish none of this had happened, and I wish someone had figured this out sooner. And because the veterinarian is the person who's supposed to know, they're supposed to know. But the reality is that you only have what you have to deal with, and you can only make your best judgment based on what's going on with this individual dog at any given time. And the things get missed, and things couldn't have been found in the first place. And the guidelines are only ever there to suggest a way through the wilderness of actually just being there with the dog and paying attention to that dog. And as dog owners, I know as a dog owner, it's my job to make sure that I understand my dog really well, and that I know what's going on with her. And then I consult with my veterinarian about that, because she's my dog.
That is true. Sometimes things are truly missed. Mistakes happen in any field, and veterinarians are not immune to making mistakes, as well-intentioned and as diligent as we all try to be. In reality, with many cancers, there can be situations where cancer is more insidious. So it grows internally, and maybe, especially in a larger breed dog, it's not something that can be felt or detected when it's very small. It may be a silent tumor and cause no clinical signs for a longer period of time. And if a dog is otherwise healthy, we're not necessarily doing advanced imaging or other testing at a routine wellness exam that may pick up that tumor. And those tests can be very expensive and sometimes require sedation or anesthesia. And so just like in the human realm, we deal with probabilities. What's the probability of a dog having this problem and needing this type of test, so that we're not doing CT scans every 6 months on a dog, right? And anesthetizing them and, putting them through that procedure and their people through the cost of that procedure. So there is that. And some cancers also come up very, very quickly, like lymphoma, for example. Lymphoma can arise within days to maybe a week or two, or a month or two at best. So many of the aggressive, especially the immune system cancers, they can propagate very quickly. And so a veterinarian may have seen a dog for a wellness exam who had totally normal lymph nodes and was quote unquote healthy. Mast cell tumors can pop up very quickly as well. Sometimes I'll see a dog and then 2 weeks later they have a tumor pop up, and it's like, well, why didn't you see this? And it wasn't truly there. And so those types of situations can happen, and it can be frustrating for people because they may not realize that the rapidity with which some of these problems can develop. So oftentimes it's just a conversation and communication about those disease processes, a little bit of education, and most of the times people then come to understand, okay, this really could happen on that time frame, even though it doesn't seem feasible. But sometimes that really is what's happening too. It's not that a vet missed something; it's that it truly wasn't there or wasn't detectable at the time that they were last examined.
Yeah, that is so important. It is shocking how quickly mast cell tumors and lymphoma can just pop up out of nowhere. It blindsides people, and of course it does. It's shocking how quickly they develop.
It is.
And there's no way to know that they're coming.
Diligent screening and really, again, the more eyes and hands that we have, partnership between the pet owner and between their veterinarian, is usually very instrumental in detecting cancer early. And the earlier we detect it, just like on the human side, the more options we often will have.
Well, thank you so much, Dr. Brooke Britton, for that comprehensive and helpful answer.
Thank you.
Hoping for a regular dose of hope along with the latest information on dog cancer? Subscribe to our email newsletter, Dog Cancer News, at dogcancernews.com. Each week, we send support, guidance, hope, and information via email to dog lovers just like you. We know what it's like to have a dog with cancer, so join us and subscribe to Dog Cancer News at dogcancernews.com.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.